Let us pray together. Dear Lord, we thank you for yet another day that we're able to see the sunshine. I pray now in your name that even as we continue to battle this invisible foe, that you give us courage, strength, and wisdom, and allow our leadership to understand the way so that we, as we continue to press on, allow those that have been affected by this hidden disease to be delivered and set free, and their grief to be, God, in many ways relieved. We thank you for what you're able to do. In your name we pray. Amen.
Thank you. And ladies and gentlemen, thank you for coming. The purpose of these press conferences is to let people know what we're doing, what we're thinking, and why we're doing it. And so we welcome you all here again today for your presence and your questions. You may have noticed that the people of South Carolina are complying very well with the orders that have come out and the recommendations that have been issued as well from us and from the CDC and other places. So in light of that, in light of the common sense being shown by the great people of South Carolina, we are ready to take some steps that will help South Carolina assure that our economic health is as strong as our public health. On March the 30th, I issued an order that closed access to the beaches along our state. Since that time, I have spoken to all of the mayors that are along the coast, or most of the mayors, if not all of them. And today I am canceling that order effective as of noon tomorrow for those beaches, and taking the power of that order off of those governments so that the decision making returns to those governments in those beaches, those places, to make their own decisions as they did before I issued that order. So we're turning that back over to the mayors and the councils to make their own decision, and that includes the public access, that is the government-owned access to those beaches, as well as to the piers, the docks, the wharfs, or the ramps in those locations. Also, another part of the executive order I'm issuing today, on April the 3rd, I restricted some retail businesses to pick up and delivery only. We closed them for other operations, but encourage them to continue with the pickup and delivery subject to social distancing. And you know this included furniture stores, shoe stores, department stores, music stores, sporting goods stores, craft, flea markets, and florists. As of 5 o'clock today, I am canceling that order, but I also remind those merchants and those customers that the order concerning social distancing is still in place, and they must still do that. And in addition, the restrictions that we had announced earlier on the big box stores and the home supply stores will be in effect on these other retail businesses, and that consists of two rules. One, either 20% of your occupancy, your regular posted occupancy, you can go that high, or 5 customers for every 1,000 square feet in the establishment, whichever is the lesser. So that way, the big box stores and the small retailers as well that had been restricted are restricted now only in that fashion. And back to the beaches for a moment, still in effect is the rule, because this is a state of a declaration of emergency. The rule of law enforcement to dispel groups of 3 or more that are causing a threat to the public health is still in effect anywhere in the state, and of course that includes the beaches. The decision on schools we've not made yet. That will be made in consultation with Superintendent Molly Spearman and the school officials, and we're studying the data, the science, the information that we have, and we'll be making that decision before long. But I urge everyone to remember, we are still in a very serious situation. We know that this disease, this virus, spreads easily, and we know it is deadly, particularly to a lot of our people who are older or have weakening diseases that have weakened their or suppressed their immune system. So we must be sure that we continue to be strict and disciplined with our social discipline and taking care not to infect others. Our measured, deliberate approach has been the right one, we believe. Our goal was to cause the most damage possible to the virus while doing the least possible damage, at least permanent damage, to our businesses. South Carolina's business is business. We must, when this began, we were outrunning the competition in many of our races with the competition. We want to be able to continue to do that when this virus is gone and as we're pulling out of it. So what I am doing is we want to be able, if you can imagine a race, we want to be able to slingshot around the competition and get back up to full speed as soon as we can. And to that end, I have created a organization called Accelerate South Carolina. We must be ready to stomp on the gas when the green flag, when the green light comes up. We have to be able to accelerate as fast as we can and as safely as we can with the health of the people when that green light goes on. So to do that, we have Accelerate SC. This will be an organization that will last for about 30 days. There will be a number of meetings, and we'll supply you with the list of the people that have agreed to serve. It's a volunteer organization. We'll have several meetings. They will be managed and coordinated by Mr. James Burns, an attorney with Nelson Mullins Law Firm here in Columbia. And our first meeting will likely be at the University of South Carolina Alumni Building. So this Accelerate SC has 29 participants, and it includes all sectors of South Carolina's economy: manufacturing, tourism, hospitality, agribusiness, service, and healthcare. What will it do? It will target workforce needs, logistics, regulatory issues, and transportation issues. These are things that are outside of the scope of the healthcare professionals and DHEC, with which we work very carefully. Accelerate South Carolina will also address protecting our most vulnerable citizens, our seniors, our minorities, our rural citizens, and those with chronic diseases, which, as you know, makes them more susceptible. We will have plans and initiatives for testing and access to treatment that we hope will be thorough and highly effective. Accelerate South Carolina will also serve as a one-stop information resource for all of our state's residents. We hope to make it so easy to use that anyone will enjoy using it to help find their way into the proper government services and others that are available. And it will work by on the web, by email, and also by talking to a live person who can direct everyone where to go for unemployment, small business loans, licensing, permitting, social services, and all of the above instead of getting lost in the web on the internet. Accelerate South Carolina will also receive input and advice from the members of the General Assembly appointed by the Speaker of the House and by the President of the Senate. As I say, we anticipate 29 participants to begin with, as well as a lot of advice from others who will be associated with the effort. We anticipate that Accelerate South Carolina will meet this week and as many times as necessary, but to finish the work, advice, and guidance within 30 days. And by then, we should be back in the victory lane with our economy. Dr. Bell.
Thank you, Governor. Good afternoon, everyone. Today, DHEC is reporting 64 new cases of COVID-19, excuse me, which brings the total number of people, not counts, who have tested positive for the disease in South Carolina to 4,439. And we don't want anyone to forget that we're always talking about people, not numbers, and that unless an individual is strictly controlling their contact with individuals, that everyone continues to be at risk of exposure to the virus circulating in the community. DHEC today provided an updated summary regarding cases confirmed to date, as well as projections through May the 9th. And so what we're seeing now is that the projections currently indicate that South Carolina may see 750 new cases per week by early May, and that the total number of cases is estimated to grow to 6,953 by about May the 9th. Now, so meanwhile, on April the 17th, the University of Washington's Institute for Public Health Metrics and Evaluation presented updated modeling for South Carolina and, well, for all states. And for South Carolina, this indicates an earlier estimated peak for bed utilization, which is now around April the 15th, and the peak deaths that we may see around April the 9th. Together, these two projections indicate that the curve may have begun to level for us here in South Carolina. Modeling projections and data trends vary, and they can still change very quickly. And we recognize the need to be very, very cautious in relaxing preventive measures so that we don't see rebound disease activity. This is why we're continuing to look for opportunities to increase testing across the state so that we can better identify unrecognized cases that have not yet been reported, and to be able to better monitor disease activity in the state. It's important to remember that even as we work to flatten the curve, that people will continue to be infected, and that positive cases will continue to be reported, and unfortunately we will continue to see deaths for many weeks to come. We're still learning about this virus, and we don't have a great deal of certainty about what to expect. Based on our current data, that we are consistently seeing a plateau in cases for a few days now, and that the risk of transmission, however, still remains high despite early indications of a potential plateau. As the restrictions that have been mentioned are reduced, it will remain absolutely critical that everyone continues to perform the recommended activities to stop the spread of this disease. So as new activities are allowed, it's very, very important that people continue to practice all of the social distancing measures that have been in place and should remain in place. As of today, a total of 41,277 tests by both DHEC's Public Health Lab and private labs have been conducted in the state. We're seeing approximately 10% positive tests from the South Carolina residents who have been tested, and this is related with what is being seen nationally. Our state's public health laboratory does not have any delay in testing, and we have capacity to perform a great deal more tests. We're currently working with the South Carolina Primary Health Care Association and the Office of Rural Health to assess how federally qualified health centers or our community health centers and rural health practices are prepared to assist with the needed to perform testing, and we're prepared to assist with assessing the resources that they need to do that. And apart from testing, some of the other steps that we can all take to help stop the spread of the disease and to keep the curve flattened and on a downward trend is to continue to practice the social distancing, is to wear a mask at all times when you're in public, when you may come in close contact with other individuals, to disinfect frequently touched items often, and to regularly wash your hands to prevent introducing the virus, and to also carefully monitor for symptoms and stay home whenever you're sick. And as an additional reminder, our current data does show us that social distancing and staying at home is working, and that must continue. And we realize that what we're asking is not easy but it still must continue for some time into the future until we have greater assurance that we're on a downward side of the curve and for a more prolonged period of time. And I do want to thank all South Carolinians for their individual efforts to stay home, to socially distance, and to take other recommended precautions for protecting themselves and for protecting the community as a whole from the spread of this virus. So please, everyone, continue to make wise decisions, continue to do what's recommended, and as always, you can visit the DHEC website at scdhec.gov/COVID-19 for the most current information. Thank you.
Thank you, Dr. Bell. Well, as you heard from Dr. Bell, we're still in a very serious situation. There's still a lot that is not known about this disease, but we do know it's deadly, and we do know it spreads easily. And we know that our seniors are more susceptible, as well as those with chronic conditions of many different kinds. So although we are easing some of the economic restrictions, we should not ease at all and are not easing any at all of the public health restrictions. It is vitally important that people understand that those restrictions for public health are still very important, and we must continue with the social distancing, the hand washing, and the other things that Dr. Bell mentioned. It'll be some time before we'll see which way these various trends are going and which way the evidence and science will dictate that we can take more steps. But we're still in a serious situation, but also South Carolina's business is business. And to the extent that we can, we must let those businesses operate, because people want to work, they need to work, the families need to work, they need the jobs, and we're going to do all that we can do to see that they can do that and continue with their lives as much as possible under these very serious situations. Are there any questions?
Governor,
Back in the back, sorry. Yes, ma'am.
Thank you, sir. Governor, I have a question about two things, both related to the White House guidelines to reopen business. One is that there's a requirement to see 14 days of steady decrease in the number of cases. Another requirement is to have robust testing and contact tracing available. To the issue of cases, how many consecutive days has South Carolina seen a decrease in cases? And to the tests, do you have enough tests available for every worker who would want to go back to work?
I maybe can answer some of those, then I'll ask Dr. Bell. We have had those guidelines. Of course, we had another conference with the Vice President today, and the President and the Vice President. I think that was yesterday. Those are good guidelines. What we recognize here, another factor that's very important is the compliance of the people, the compliance of addressing and following the recommendations for social distancing and those things, and that's a big factor. Doctor,
Are you not following some of those guidelines?
we're following. Those are guidelines. We're following guidelines. They're not. That's not the law. There was the guidelines, and they're very good. They're well thought out, and we appreciate it. We have information here from our professionals here in South Carolina as well, and we go by that as well. Yes, ma'am.
As far as our case report data, we have seen ups and downs in our case reports, and some of that has to do with increased testing. Some of the rapid increases have been partly attributed to increase in actual disease activity, and some have been attributed to delays in getting results of tests that were performed earlier. We have not yet seen a consistent decline in case reports. What we are seeing for a few days now is a potential leveling off of the number of cases reported. So at this time, we don't have good trend data to say that we are actually having a consistent decline in the course. We are seeing a plateau of a few days, and so what we'd really like to see is a significant downward trend that lasts, as you mentioned, for at least 14 days to be more comfortable about the disease activity in the community.
Yes, sir.
Dr. Bell just said we haven't seen a consistent decline. Why not? Why allow businesses to reopen if we haven't seen that decline? What data point are you using?
Well, because we have seen compliance and common sense in our state. And the restrictions that we imposed are different in a number of ways from what they've done in other states. But we believe that this is, that we can do this without, if compliance remains at the high level that it has been, we can do this without endangering the population.
Is there a data point that will cause you to change direction?
There's no single data point, but we, of course, rely on the science, the data from Dr. Bell, Dr. Toomey, as well as the other professionals that have given us copious advice.
What happens if, when you open these businesses, people start going to these businesses and we start to see an uptick, then what?
Well, we still have the rule of the 3 or more that are congregating, causing a threat to public health. That's a criminal law. It is still in effect all across the state. So we have tools we can use, but we don't want to have to use those tools. And if the people will follow the suggestions of the public health authorities, and you see it on television everywhere you go, we know what to do. We just have to do it. And so far, except for earlier on when we had a lack of compliance on the beaches and some of those islands, except for that, we've had remarkable compliance among the people. Yes, ma'am.
But Governor, you've also said consistently that what you're talking about with law enforcement breaking up unruly groups of people, that didn't apply to people who are going about their day shopping and going in and doing business in the community. If you're opening up more businesses, couldn't that be a problem?
That applies across the state. That's a criminal law. It comes into effect when you have a state of emergency that's been declared. It's just like the price gouging law. It applies wherever the infraction occurs. Yes, sir.
Yeah, this question for Dr. Bell. Can people safely return back to work if they're not tested? And if that's the case, then are there enough tests to test every single worker just to follow up in this state who would like one to make sure they haven't been exposed before they risk the potential to expose their coworkers or customers that come into their store?
Well, so several questions there. The first being, can people safely return to work? And, public health practitioners are strongly recommending that people only participate in essential activities, and those businesses that provide those essential services and activities are very important. So the return to work for those individuals is one of the key questions. We all obviously want to see an economic recovery, but at the same time we have to along with that, give the message that the risk of exposure remains for everyone. There are, we ask all employees to work with their employers to make sure that they have the personal protection that's needed to conduct business, and this can include the use of masks in retail settings. We certainly have to separate certain businesses from return to work for healthcare workers. So the risk for exposure remains until we see a significant and persistent decline in disease activity. That's why we encourage everyone to take those personal measures to protect themselves, their personal hygiene. I think that's the answer to your first question. You had
is there adequate testing then available to test every employee that wants to get a test in this state so they know they're safe?
Now, we're not pursuing to test every single person in South Carolina, but we do most certainly want to increase our ability to sample in the population, especially in areas where we recognize that testing has not been widely available. So until we, and we are taking very aggressive measures to assure that at this time, to increase testing in communities that have not had ample access to testing. And it is the data that once we get that done and really ramp that up, the data that we collect from more widespread testing will give us more information about unrecognized cases in the community, and we'll have a better picture of whether there is a sustained decline in the state or not.
Yes, sir.
Many viewers are concerned and scared about, obviously, going back into public, with, the coronavirus still out there. Question is it a concern that we got a second wave, and if possible, how bad can that second wave be, and are we prepared for that?
That's what we are concerned about. That's why we are taking a gradual approach. I'll let Dr. Bell comment, or Dr. Toomey as well. But we took a gradual, measured approach going in. And there was some of the small retailers we restricted to only the curbside or pickup service. Some of the retailers, the big boxes, were restricted at some time earlier to a 20% of their capacity or no more than 5 customers per 10,000, per 1,000 square feet. That is the rule that we are now applying to those smaller retailers that we had restricted to the curbside. We're not opening things back up all the way, but just going out gradually, just like we came in gradually. Dr. Bell, would you like to respond to or Dr. Toomey?
As the governor said, and as Dr. Bell said, I think following the guidelines and following the best practices in limiting your potential number of people congregating. To share a little story, Saturday night my wife and I went to a small retailer and they would only allow one of us in at a time. And they thought they were apologizing to me. They didn't know who I was, and they were saying, and I said, no, I understand exactly, and I applaud what you're doing is to protect not only your employees, but other individuals in that store because they had already had a few numbers. So I think the adherence to the guidelines, the phased-in approach will, we hope, optimistically, we expect it to continue to what we've done as South Carolinians is to be careful, be smart, and to recognize that we have a social responsibility not only to each other and to our family members, but to our other citizens in the state. So we're optimistic that it's not going to have a second spike. There's no guarantee, though.
Next question. Yes, sir.
So I know with the beaches, the important thing, I know with a lot of people coming in, maybe from out of state, might want to come to the beaches in South Carolina. Is there going to be any plans to lift the 14-day quarantine for people coming in from hot spots like New York and New Jersey or New Orleans? Or do you think people from out of state should adhere to that 14-day if they choose to come into South Carolina?
Well, the first part of the question, those orders are still in effect about the reservations from those hot spots that were recognized, states recognized by the Centers for Disease Control. They actually issued a domestic travel advisory for those states asking those people to stay there. That was New York, New Jersey, and Connecticut, and perhaps New Orleans as well. So our order to that effect about reservations is still in effect, as is our quarantine for people coming from those places. We will take action on those when and if we deem that appropriate. Yes, ma'am.
Governor, just want to clarify, you mentioned that you are hoping that people will adhere to the rules that are already in place. Just wanted to know about your medical team and people who are on your staff with you or on your council. Do they agree with doing the openings that you're suggesting? Because it sounds like we're not seeing the leveling off that we need, and so you're just hoping that people will do the appropriate thing.
Yes,
so just want to know what conversations you have behind closed doors.
This is a gradual step. Don't misunderstand. We're not opening up all businesses as usual by any means. We are removing the restrictions that were on small retailers, some small retailers, not all small retailers, but those that have been adjudged to be in the non-essential category in a lot of states. And we viewed them in that category as well, although of course they're essential to the people that work there and the families that depend on it, but also those that had the greater propensity for congregating and for personal contact. We were very limited and very gradual, but when we issued that order, we allowed the pickup service, the curb service for those businesses. What we're doing is lifting up, going one level up, allowing the same degree of business that we have in the larger stores, which is 5 customers per 1,000 square feet, or 20% of the posted fire marshal type limitation. And we think that step is a good one. We are confident that I'm confident that if our people follow the guidelines, follow the recommendations of social distancing, which many of our businesses and other places have been doing without any order or instruction to do so, other than we recommended and urging them to do it. If they'll continue to do as they were doing before, we ought to be fine, and we'll allow those businesses to stay alive. If we must, in destroying this virus, we must be sure not to destroy permanently any of these businesses. We have a lot of aid coming in terms of unemployment and all that, but that's not the same thing as that business being able to survive on its own.
We understand that, Governor, but the downside of that are deaths. So if you're making the wrong call or moving too fast, that means people are gonna lose their lives. So all I'm asking is, since people have not abided by the rules of social distancing properly when the beaches were open, are you and your panel comfortable with opening things gradually with the other alternative being people dying?
I'm speaking, we are comfortable in taking this gradual step that I have announced. As for the beaches, we are turning that back over to the authorities, the local authorities, who were in charge of making those decisions before we took that into a state context. This is a gradual step, and we have confidence that it is a good, well thought out step, and we are confident that the people will be able to operate safely with it. Yes, sir.
Dr. Bell said that they have yet to see a consistent decline. Do you feel by any stretch that this decision is being rushed because of the concern about the economy in our state?
No, we have not rushed a thing. As you have noticed from the beginning, we have been deliberate, measured, and cautious in every step we have taken. This is another step that we have taken with that same context. Yes, ma'am. Question?
He asked the exact same question that I was going to ask about criticism, that you're putting a priority on business as opposed to health concerns, because we're hearing from your health experts on whom you say you rely that there are still real concerns and that we're not on the downward slope.
We all still have real concerns because this disease is just as deadly as it was before. But we are taking cautious steps. We took cautious steps. Every step we've taken has been cautious and measured, and we believe that this measured, cautious step we're taking here is in the right direction at this time. Yes, ma'am.
Yes, you're reopening a certain category of businesses. For the others that remain closed, when will you be reopening those? And if there's no set date yet, what will you need to see to have the confidence to reopen?
Yes, there is no set date, of course. There's no set date for any of these things, as Dr. Bell and Dr. Toomey have said numerous times, but we're waiting, we're studying, we're analyzing to see what we can do, analyzing the figures, analyzing the trends to see when it is time to take steps concerning those businesses which are closed. We would like to get everyone back to business safely as soon as possible, but not a minute before it is safe to do so. Yes, sir.
You had a gradual approach with your executive orders. Do you think your individual rollouts of these executive orders caused any confusion amongst local governments, local leaders, and South Carolinians overall about how to handle responding to this crisis?
Do I think that this situation has caused confusion?
Do you think the rollout of your orders has caused confusion?
We had comments from people all over concerning those orders. Some thought they were perfect, others thought they were not perfect, but we are basing our decisions on the science and the data and attempting to make it as clear as possible. Yes, ma'am.
While there's no timeline, you have said that you hope that we're open for business in a month and that this task force
I'm sorry.
You've said that you hope everything's open in a month and that the task force will be in effect for a month. What do you think in the month ahead, say prior to Memorial Day, about mass gatherings, events, weddings?
Good question. We'll have to see. We'll have to see what is happening. The purpose of the Accelerate SC is to determine the economic steps that can be taken within the confines of the health and safety limitations that are imposed on us by the science and the data. But we hope to move as quickly as we can. There really is no date other than we want to move as quickly as we can, but as safely as we can. If that requires going slow, then that's what we'll do. But every step that we take will be thoroughly vetted, thoroughly discussed, and based on science, the data, and the best information that we can get. Yes, ma'am?
On that note, why not wait until your task force met before you went ahead and did this?
Well, we've already been in discussions with many of those that are on the group already. This is going to be a continuing thing. We're not waiting for a report at the end of 30 days. We're going to have constant advice and information coming from this group of advisors who are across the board in virtually every aspect of South Carolina life. But this is to give a business perspective to a health situation. They are very important, both aspects of that, and that's why we're asking these people to volunteer to come and give their advice and recommendations. Yes, sir.
This question is for Dr. Bell. Dr. Bell, I'm seeing national studies and experts I've spoken with in your field talk about that to safely reopen the economy correctly, that you'd have to see 1 positive case per million people. So in this state, that would be around 5 cases per day, roughly. If that is indeed true, what evidence are you seeing maybe here that it is safe to take these measures if we're not at the 5 positive cases per day yet in this state?
Well, as I said earlier, we are continuing to work towards expanding testing. We had to prioritize testing here because of limitations in supplies and testing reagents in the laboratories. So we know what we have identified primarily here, like in other places, is those who were the sickest because they were in the hospital. And so my response is that we will do everything that we can to meet that goal, which is to make sure that testing is available, especially in underserved communities. We have now widely available testing in some of our more metropolitan areas, and we're going to work more with our rural providers, and we're actually exploring other opportunities to establish new testing sites. And that remains our goal, is to do an adequate sample that follows with what is recommended from the national guidelines.
So you feel comfortable right now with the decision to slowly take these measures based on the data you have presented?
Sorry, repeat
You feel
again?
comfortable with these measures being taken right now to relax the restrictions based on the data that you have and the numbers that we just spoke about?
Well, I understand the importance of economic recovery, but public health practitioners, you know, it's our job that we do the disease monitoring, and as long as we continue to see a high level of disease activity in the community, we will continue to recommend the measures that we know are effective in preventing disease spread.
Dr. Bell.
Governor, are you working with Governor Roy Cooper? Are you guys on the same page? Have you mentioned or tweeted over the weekend that you talked with governors and you didn't mention him? So just want to know about people even traveling to South Carolina who have homes in the area, and they're coming from North Carolina. Are you and Governor Cooper working hand in hand, and are you guys on the same page?
I've spoken to Governor Cooper a number of times, and some other governors in Georgia and Tennessee, Alabama, Mississippi. Of course, we have conferences with the governors all over the United States. But all the governors have been talking to each other, and as well as with the president and the vice president. Yes, sir. In the back. This is the last one.
Yes, sir. You mentioned Accelerate South Carolina. We're thinking for those groups that are hardest hit, such as minorities and the African American community, is anything in that program or the meetings that you all have that's going to speak directly into what's being done to help those with disparities or lack of health insurance?
The answer is yes. We mentioned that before. That is specifically one of the things that the Accelerate SC will be analyzing and making recommendations on, specifically what you just asked.
Okay, so if there weren't anything right now that you could speak of? And a little bit
No,
more detail?
we're aware of the situation. I've spoken with Congressman Clyburn some time ago about that very situation. He's taken some action there. We're in communication with our congressional delegation about things that they can do, but that is a part of this, is to see to it that those are the hardest hit are protected as much as we can protect them, because this is a deadly disease. If you get it and you're not young and strong, chances are you're going to have some serious consequences. Thank you very much.